My name is Dr. Sue Wong. I'm an internist and I'm the medical director for the Center for Asian Health and for the viral hepatitis programs at the Cooperman Barnabas Medical Center, which is a part of RWJ Barnabas Health Network in New Jersey. I also serve as the senior health advisor for global health for the Hepatitis B Foundation.
And we're going to dive into a little bit on your correspondence named Pathogens Don't Respect Politicians. For my first question, what do you see as the most immediate impact of the US withdrawal from WHO on global health collaboration?
Thanks for the question, Sophia. So, as you mentioned, we wrote this piece called Pathogens Don't Respect Politicians, just in response to a lot of the changes we were seeing from the new administration that directly affect global health and a lot of the medical institutions in the US and also abroad. So, one of the first things that happened with the administration was an announcement that the US was going to withdraw from WHO. And this is very concerning for those of us in the global health community because the US not only is a member state of WHO, but also there is a lot of work that's done between the CDC and WHO. And that was a follow-up corollary to that statement was not only were we withdrawing, but CDC was not allowed to communicate with the WHO, and their CDC staff were not allowed to attend meetings or work on collaborations with the WHO. And we wanted to make sure people realize that our global health ecosystem really relies so importantly on these collaborations that are international, so between different countries, but also different countries support a lot of the work that WHO actually sponsors or has many committees that require the input from people of all different countries. And that collaboration is really core to our safety across the world. And so I was actually in a WHO meeting where the CDC attendees could not come and they were supposed to present. And that's all of a sudden we have a missing link, right? And that missing link will have impact on us. So in terms of like epidemics that are happening, Mpox, avian influenza, we require that kind of information to be relayed from country to country. Countries that are having outbreaks rely on the CDC for information for timely responses. A lot of the labs actually provide services abroad. That way we as a global community can identify outbreaks, can have a quick response, and we're not having these outbreaks go out of control. A lot of what, I think what's happening is we feel like it's not happening in our country, it won't affect us. But in this global community, like we saw this happen with Ebola, people had traveled places, come back, and you're bringing these new infectious diseases. There's rapid spread of things. I mean, it happened with COVID very quickly. There are no boundaries. You may have a boundary on a map, but it doesn't happen in real life, right? And so this is very concerning to us, like this break in this ecosystem and the collaboration that WHO really is an amazing convener and collaborator to make sure like we're all on the same page. Our systems for monitoring disease outbreaks are really in place.
Kind of bouncing off that question, how does halting these essential reports and communications from the CDC not only affect the United States, but also globally?
So separately from the WHO announcement, there was a lot of scrutiny put on the administration in terms of what information is put out by CDC and whether it complied with the new guidelines and what language was being used. And so a number of the important communications that CDC puts out weekly, the MMWR, the flu surveillance report, suddenly were not being released. And so the MMWR, which has been around since the 1800s, but has been weekly put out since the 1950s, for the first time, did not have a publication. And this was concerning because that publication is used to really convey important, timely things that are happening, and things such as avian influenza, we're kind of expected that the flu report, so many of us use this because we're trying to track what's happening. We're in the middle of flu season. And every week we kind of expect to see what the percentage rate is like for flu A, flu B. So without that, we're really operating in the dark in terms of understanding the burden of flu in our environment. And that there are clinical decisions made based on those reports day to day that affect my patients. Because right away, I'm able to say whether we need to start doing more likely to start treatment or with testing, what we expect. And so these were very concerning things. And I think it's been beyond that, right? So there are other databases suddenly that were not available that researchers used. And some of it was taken off, some of it is being reformatted. The great news is that we've heard that there are scientists who've actually archived a number of these pages so that we have them for reference. And so I think as a scientific medical community, we have to keep on top of these things, because during the middle of this transition, what do we do, right? We still need these websites. People are still developing STIs, right? All of a sudden, the recommendations for STIs, which were on the CDC website, are gone. Where do clinicians go now for this information? And so we're in a transitional time where it's important for the medical community to communicate amongst themselves and realize where we can find reliable information during this time. So it's important for us to really have good channels of communication internally. And thankfully, a number of the like IDSA, the Infectious Disease Society, and other societies have stepped up.
Not only has this disruption affected infectious disease, as we just spoke about, but I also heard you mention areas like STIs. What other areas of public health does this affect? Reproductive health, global equity? Is there other aspects that we should be worried about as well?
There are definitely a lot of aspects that are being impacted. So besides just infectious disease, I think a lot of the vulnerable populations that we work with, a lot of the work that addresses gender equity, LGBTQ care, reproductive rights, as you mentioned, gender issues, I think these are all really being targeted. And I think a lot of those resources and the support of care for such marginalized populations is really going to be effective. We need to be on alert and also realize that we need to provide opportunities. So some clinics are not getting funding. Those of us who can provide care and may not be affected by the funding freezes, I think we need to be open and realize that, we may not traditionally provide care for these individuals, but let's open up our doors and make sure that we can be available for patients so that they don't completely lose care. So equity is important because those people who are already having difficulty accessing care may be more likely to not come, right, if there's some immigration issues. And so I think there are some informal networks that are happening in order to make sure patients feel safe to access healthcare. And those of us who, are really passionate about serving patients, I think, it's going to be a time for us to develop some of these informal networks to make sure that patients are aware that they're safe and they're able to access important services such as vaccination, regular screenings, and even emergency care.